Good morning. Thank you for the introduction. So it is well known in the literature that overactivity from the renal sympathetic nerves can contribute to resistant hypertension in patients. And in the past several years, many catheter techniques have been developed, the ablation techniques that have been effective for performing denervation and have successfully treated this resistant hypertension in many studies. And indeed, both ultrasound and MR-guided focused ultrasound have been investigated both clinically and preclinically for performing renal denervation. However, in all of these, there's really not an acute assessment that can be done immediately after the procedure to know whether it's effective. It's assessed quite some time afterwards. So the objective of this pilot study was to determine if we could assess any acute effects. And we studied this by performing bilateral renal denervation, and we started with a normotensive rat model. And to do this, we were measuring invasive blood pressure measurements throughout the procedure. We were also doing this under MR guidance, where we were looking at both quantitative T1 and T2 maps, as well as using real-time MR thermometry. So to do this, we were using 11 Sprague Dawley rats. We did 6 that received bilateral denervation and 5 were sham treatments. We performed all of these on a small animal MR-guided focused ultrasound system that operates at 3 megahertz, where we built a custom rat holder that's not shown here, where we had some nice integrated RF coils to boost our SNR. We also did this in a Siemens 3T MRI. So the protocol was we kept the sonications the same. We did 8 sonications per animal. We did 4 on each side, 2 watts, about 20 seconds, and the peak negative pressure for this was also about 2 megapascals. So the protocol was, after the rat was anesthetized, we inserted an invasive fiber optic blood pressure probe into the rat tail artery. And then once that was secured, we positioned the animal on the MR-guided focused ultrasound system. And once they were in the magnet, we did the localizers and adjusted positioning as necessary. We did some pre-ablation T1 mapping. And then we went along with our sonications, where we monitored mainly the near field, but also around the kidneys as well. Once the sonications were completed, we did our post-ablation maps, and then the animal was recovered. We monitored them for 30 days, and at that point, they were euthanized, and we harvested their tissue. And we computed the norepinephrine. We got that from the kidney medulla using an ELISA, and we also did histological analysis of the tissues. So for the results, we were able to successfully do some MRTI measurements, and shown here is only one picture. So on the left, you can see the right artery ablation, where it superimposed 4 of the sonications that we saw. And so we got a temperature rise of anywhere from about 15 to 25 degrees C over the rat body temperature. We found it difficult to monitor temperature around the renal artery because of the fat presence and the blood flow artifact. We evaluated the T1 values in the kidney and muscle, both pre and post-treatment, and we found there was no significant changes in the kidney or muscle due to this procedure, meaning at least with this metric, we couldn't detect any tissue changes. Now, we did measure the blood pressure continuously throughout all the sonication, and this was a bit of a finicky measurement, but we were able to do it successfully in 5 of the 6 treated animals. And as you can see, the results were quite interesting. For the first 2 sonications, we didn't detect pointing at myself, that's not helpful. We weren't able to detect any blood pressure change, but we did see acute systemic change during the 3rd and 4th sonication here. So in the 36 sonications that we were able to successfully monitor, we saw this transient decrease in about 1/3 of them, which was very interesting. And plotted here is the normalized mean arterial pressure versus time, where the solid line, the bold line, shows when the ultrasound energy was actually on. So in quite a few of these cases, it seemed to be in a delayed effect. So for the kidney medulla norepinephrine, now we weren't able to the blood pressure was not significantly decreased after the procedure because this was a normotensive animal, but norepinephrine is a very robust metric that tells you if you've done successful renal denervation, and that was reduced 36% 1 month post-treatment when we compared the sham to the treated group. And histologically, The animals that were denervated, we saw an increase in inflammation. We also saw pyknotic nuclei as well as increased vacuolization when comparing the renal denervation to the sham procedure, indicating that successful denervation was done and there was no damage to the vessel itself. So just to conclude, this study further supports that you can perform successful renal denervation with focused ultrasound, and it is both safe and effective. MRI provides some very useful information to monitor the procedure, not only with temperature imaging, but with other contrasts such as T1 mapping. And we also found the invasive blood pressure measurements very interesting in this pilot study, and we're going to investigate that further. So for future work, we want to investigate many of the well-known hypertensive model in rats that are used for hypertensive research. We also want to investigate the effect of ultrasound parameters, especially on this acute blood pressure decrease, and improve our MR measurements and the correlation of those measurements as well. I'd just like to thank my laboratory and my funding sources. Thank you.
Thank you for the timing. We have time for question.
I heard that there have been some clinical trials run in Europe on a human.
Yes, many clinical trials have been done in humans for renal denervation.
How does this compare to the clinical trial results?
Very similarly, most of the clinical trials have been positive and have shown they do see a decrease in blood pressure in resistant hypertensive patients.
And how does this compare with RF ablation?
It's a similar result. Since I don't have blood pressure measurements for this normotensive model, I can't make a direct comparison right now.
Thank you.
How large are the renal arteries in the rat?
They're really small. They're less than a centimeter in length. And about
in the diameter?
The diameter it's only about 2 millimeters, if I remember.
This is one big difference, I think, with radio frequency. You wouldn't be able to ablate, arteries like that. And the way things are headed in the clinic is that it's the smaller blood vessels inside the kidney that are probably better ablated than the larger renal arteries. So something like this is, I think, more apt to be effective later on. The other question is, was the ablation that you did to see the acute change in blood pressure, was that the same as the ablative dose, or was it a different dose?
No, it was the same dose.
So you were going for ablation, then you were just seeing some transient hypotension during the ablation?
Exactly.
Oh.
Yeah.